Again, good afternoon. I'm Joy Hurley. I'm the Assistant Director of the Admissions Office at the Gatton College of Pharmacy. I know that you've probably heard a lot about our pharmacy because, of course, it's still pretty new to the college. How many of you all are interested in pharmacy? None. Wow, I can leave? No, just teasing. How many of you all know exactly what you want to do? Just a few? How many are still kind of out there? Don't know. Okay, good. Now I can stay. Well, I'm just going to do an overview of the Bill Gatton College of Pharmacy because I need to engage you in the career of pharmacy, just to let you know that it is more than just the retail pharmacist that you go to when you go to Walgreens or Walmart to receive your medications. There are many aspects of pharmacy as a career. There's a career in nuclear medicine. There's a career in clinical pharmacy if you want your own patients and you round with doctors to determine the right sets of medications for the patients that are in the hospital and ICU. There's an emergency room pharmacist. Could you imagine who do you think is the person that's responsible for the call that they get that they're getting a patient coming from the ambulance that has OD'd on medications? It's not the ER doctor, it's the ER pharmacist. They're the ones that's determining what medications this person is on, has taken, how to interact with those, how to give drugs to help this patient survive. So there's tons of career opportunities for you in pharmacy, and that's just a few. You can also specialize in pharmacy, as well as, for instance, we have pediatric pharmacy. We have a brand new children's hospital at the right across the street from the Gatton College of Pharmacy, and we have 2 chairs that are pediatric specialists that are our faculty members, and they also go on rounds at the children's hospital. So just to go over a little bit of just who we have, this is the Department of Pharmaceutical Sciences, and every single Department of Pharmaceutical Sciences is your research side. So you have the research of medications on the pharmacy side, and each one of these professors has a research project going on. So maybe you're thinking about research, or if you like the lab setting, pharmacy is a good fit for that. I know for sure that Dr. Pond, who is working on the long-term effects of Ritalin on the brain, who all knows what Ritalin is? Everybody. It's dispensed like candy, pretty much. I mean, for ADHD or ADD is what it's used for. But there's not one study in the nation, or actually in the world, for the long-term effects of Ritalin on the brain. So if you're giving it to children who are 5 to 10, 12 years old, their brain's not fully developed. So there's nothing showing in the statistics or studies saying, you know, is it a proper medication to give? Is it going to have long-term effects? Is it going to be helpful? Is it not? That kind of thing. And she's come leaps and bounds with her research on that, and she's getting ready to have a scholarly article published in a medical journal, which is phenomenal. Dr. Remsauer, she is working on research for different stages of breast cancer stages, and she actually injects plant proteins inside of the cells to see if there's promise of those particular plants. If there's promise, then she'll move it on to the next stage, and that's Dr. Harafarouche. He'll take that next stage and move with that. She's had promise as well, and there's students that worked in her lab and actually was part of the authors to have that research published. So I have pharmacy students that haven't even graduated yet that have already published scholarly medical articles in a scholarly journal. I mean, that's going to look nice on their resume. So it's just something to think about if you're interested in the research side of pharmacy. And then this is the Department of Pharmacy Practice. Dr. Lugo is the gentleman I was telling you about that is a pediatric specialist, and Dr. Thigpen is also a pediatric specialist. Dr. Hess is a diabetic specialist. He is one in five states, I think, that is actually a diabetes specialist, and he has his own patients. They schedule the physician's office scheduled diabetes patients to just see Dr. Hess, and Dr. Hess will evaluate their chart, their medications, and say, oh, well, let's see, you're on 10 insulin shots a day. Have you considered possibly using an insulin pump? And he actually implements the insulin pump in-house, in the clinic, in an in-stay situation to help those patients. So if you're thinking of medical school, pharmacy is very similar because of that. Profession is changing. You have your MDs who are are the ones that is going to diagnose, and then your pharmacists are going to be the ones that are going to be that will determine the proper treatment. That's the way that healthcare careers are going. So you're going to have a PhD in pharmacy. Okay. And basically how our curriculum philosophy works, it's moving from passive learning to active learning. How many students study for a test the night before or 2 hours before a test? Yes. Yes. Exactly. I did it. I'm still doing it. I'm in a master's PhD program. Same thing. If I just need to study for a certain section that I know that I'm absolutely not going to use for the rest of my career, I study it, I regurgitate it on the test, and I move on, and I move my brain, move it out of my brain so I open it up for other things. You can't do that in the career pharmacy or in the health sciences. For instance, I'm going to flip through and kind of show you a patient profile because it's lifelong learning, and I'll come back to that. But I'm going to give you an example, blood pressure. How many knows what the normal blood pressure is? What is it? 120 over 80. This is a heart attack waiting to happen. Okay? In pharmacies and in even Walmart, you know, the little machine where you put your arm in, they do the little blood pressure thing, and we're gonna pick on a 68-year-old man. He has 160 over 110. He goes up to his pharmacist and says, "Is that bad?" Yeah. Okay. The way that our philosophy for you to learn is the basic knowledge. If you're a pharmacy tech or a pharmacy student and you're a P3, that's your third year, and you don't remember what 120 over 80 means, you're not going to know how to help and treat this patient. You're not going to know that he's a heart attack waiting to happen. You're not going to know what systolic blood pressure means or diastolic blood pressure means because you studied for the test, and then 3 years later you're like, oh yeah, what was that? Do you see why this is a good example to show you you're going to have to remember everything you've learned that first year, 2 years? Something else that we incorporate in our curriculum in our pharmacy school is experience. We want you to have experience and exposure to the career from day one. So the second week that you come to school, to pharmacy school, you will be certified to give immunizations, which you could get B12 shots, flu shots, all kinds of regulated shots within the pharmacy. And then you can help, once you're certified there, then you can get out into the community and you can work for an independent pharmacist, you can work for a community pharmacist, a compounding clinical, the VA hospital, and we expose you in our college to those elements of pharmacy, those careers. So, and this is all the nice, lovely classes you all are taking as an undergrad that you will take at a professional level once you get into the College of Pharmacy. Okay. Is anybody having questions about that at this moment? No? Okay. And this is basically saying why it matters. The information is foundational. All clinical training is built upwards from the foundation. Knowledge of the basic sciences gives you credibility within the larger field of the healthcare team. So if you're a pharmacist and you're doing rounds with the physical therapist, with the occupational therapist, depending on the patient, with the nurse, the cardiac, maybe that gentleman that the patient you're getting ready to see may have had a heart attack. Well, if that patient had a heart attack or a stroke, that patient no longer just has a internal medicine doctor or a family practice doctor. He has a cardiologist now assigned to him. He has physical therapists, cardiac rehab assigned to him. He has a pharmacist assigned to him. Maybe he's diabetic. Now he has a diabetes specialist assigned to him, a nutritionist. So you can kind of imagine how this health career, in anywhere you go, how you're all going to have to learn to communicate with each other. And that's something that we incorporate in our curriculum as well as a communications course. And if you're a P2, you have a communications course that's mandatory for you to have this class with medical students, nursing students, rehab students, physical rehab, rehabilitation students, which is really neat because then you get to all learn on the same level, and then once you get to where you want to be, you know each other and you can help bridge those communication gaps that you see in the health field now. Does that make sense? I'm not going to bore you with this whole presentation slide. I only have a few more minutes, but I'm going to go into now more of, this is just our curriculum, kind of give you an overview. I'm going to show you how your schedule would look if you are a P1, if you're a pharmacy student. And there we go. What we do at the Gatton College of Pharmacy is we give you this real pretty color-coded schedule the first week of school, and you'll know through the whole year how to time manage. You'll know that every Monday and every Friday is a test block, an exam block. You're not going to have you have 5 classes here, but you're not going to have 5 exams in 1 week. You're going to maybe have a pharmacology or a pharmacy calculations test on Monday, or you might have a biochem test on Friday, but you know when those are going to be so you can plan accordingly. As you can see, you're pretty much in class in lecture time almost 40 hours a week. This is very comparable to medical school. Okay? A lot of students ask me, can you work while you're in pharmacy school? We don't recommend you working because you've got to time manage. Your number one priority is to become a pharmacist. Your number one priority is to get through school. If you can work, that's great, and some people do that just for internship purposes, and they work about 4 hours a month just to stay on payroll. It's either on a Saturday or Sunday, or maybe a Thursday afternoon if they don't have a test that week, that kind of thing. So is this helpful? So you can kind of see that would be the way it would be for any health career that you're choosing. It would be this extensive, whether it's dental, whether it's pharmacy, whether it's medical. This is what you're getting into, so you just need to prepare yourself for that. Okay, and so the next step is how do I prepare myself for this? Okay, this is what I've decided to do. This is what I'm going to do. How do I prepare myself for the application process? How do I become the most competitive student? Which I'm sure that's a question on your mind. Is that a question on your mind? I'm not going to assume anything. Okay. I have some packets of information. This is just our pharmacy admissions packet. It just kind of goes over what we require. We require a PCAT, which is similar to an MCAT. And basically the PCAT is broken up in a couple of sections. You have your biology, your chemistry, your quantitative, your reading, and verbal. It is a monster of a test, just like it would be for the MCAT. There are prerequisites that are required. You do not have to have a 4-year degree to get into pharmacy school. If you go down the prerequisite courses and finish those by your sophomore year, the beginning of your junior year, you could be a pretty competitive student to apply for your junior year, because you basically will have these courses out of the way, and you can study for the PCAT, get that out of the way, and apply, because you're applying a year early. So, but it is competitive to get into pharmacy school. We receive over 900 applications. We have 80 spots. That's the way it is with a lot. I mean, I know with the Quillen College of Medicine, I think they have 60 spots. They might be going up to 66 or 68, something like that, 70 maybe. And they get comparable amounts, if not more, of applications. So the question is, how do I be competitive? You make the highest grade you possibly can on all the classes that you like and don't like. Because just because you may not like this class and it's a prerequisite, you just don't know how important it is to have a pretty decent GPA to be competitive. How many do I have freshmen in here? Sophomores, freshmen, sophomores, juniors, seniors. Okay, awesome. It's a good mix. Good deal. If you do have any questions, I have cards as well, so that if after I leave, you can shoot me an email saying, hey, you know, I am interested in pharmacy. I'd like to talk to you more about it. I'll be glad to set up a time to talk with me at the College of Medicine or College of Pharmacy, and we can give you a tour, that kind of thing, so you can kind of see what you're getting into. We also compound. Does anybody know what compounding is? It's kind of basically making medications from scratch. Compounding medicine is very prominent here. Do I have anybody that's interested in veterinarian medicine? Be a vet? No? Okay. My point to that was, if we have a student who's a pharmacy student who wanted to be a vet, and he compounds veterinarian medicine. So, okay. We don't require, or we don't have a minimum GPA or a minimum PCAT score to get into our pharmacy school. On our website, it shows that the statistics of the incoming class, so it's kind of a gauge for you to see that if 80 students are chosen and an average is a 3.49 or 3.5 and a PCAT score of 67, 78, that you would need to get a pretty comparable score. But don't be devastated if you get a 58 and you have a 3.3. That doesn't mean you're not getting in. It just means of an average. I mean, we don't cap that, and we don't give a certain score. For instance, my freshman, you're not sure what you want to do. You have kind of just sail through until, say, your junior year, and you might have a 3.0 GPA, or you might have a 2.9 GPA, and then you really say pharmacy is what I want to do, and your math and science GPA by the time you're a senior is a 3.9, and you have all this pharmacy experience, and you make an 82 on a PCAT. Why would we not want that student if we cap it at a 3.5 GPA? We would have lost you. And we don't want to do that. Okay? Does that make sense? Okay. Am I losing you? Trying to think if there's anything else. I'm going to open it up right now. I mean, I've got about 5 minutes left for any questions that I can help you with in the application process. Yes. I have one student who is the youngest student that applied who had dual enrollment, and those do count. Individual basis, we accept dual enrollment credits, and we also accept the CLEP testing, things like that. He did that. He did both, and so he kind of came in as a freshman, as almost a sophomore. So, and he was 19. Mm-hmm. That's rare. Like I said, we've been in existence 4 years. There's only 1 out of 4. I mean, he just had it all. He had the experience. He had been a pharmacy tech since he was 16. Just rural area in Honaker, Virginia. Everybody know what that is? Yeah, me too. So, I mean, he was everything that, we were looking for, and it's just great. He's in all kinds of leaderships. He's a president of our APHA and our CPA, which is our Christian Pharmacy Fellowship Associations. We have 3 fraternities, co-ed fraternities in pharmacy school, and they're very service focused. They like to give back to the community. There's so many service hours that you can fulfill in those fraternities. They usually designate one charity, and I know that Kappa Epsilon, they focus on the Ronald McDonald House, and then we have Phi Delta Chi, they focus on St. Jude's, and then we have Kappa Epsilon, Phi Delta Chi, and can't remember the third one right off my head, but they focus on the Dispensary of Hope. So that makes sense. So you can definitely get involved. But great question, thank you. Anybody else? No? Okay. Well, I appreciate your time, and I'm going to leave these packets with your professor so that after the other speaker that comes up, you will be glad to take some of that information home with you to look it over, and if it's something that you're interested in or would like to even come and visit the College of Pharmacy, I'd be glad to talk with you and set that up, okay? Thank you for your time.